this order and would like a motion. This meeting of the Health and Education Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Thank you. That was Commissioner Key. Commissioner Gammon, very good. Will you call the roll?
Commissioner Key? Yes. Commissioner Gammon?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Cook?
Yes.
Chairman Allen?
Yes. Before we begin, I think it's just necessary for us to take a moment of silence in honor of Dana Garrett. I'm going to try really hard not to get emotional as I talk about this, but she meant a lot to me personally. She meant a lot to this county. She was a fantastic leader in the face of just completely uncharted waters. So it's a huge void that we will fill, we will move on, but it's definitely appropriate for us to take a moment of silence and honor her. So please join me in that. Thank you all. Okay, our first order of business is an approval of the minutes. Turn your microphone on.
Make a motion that we approve.
Very good. Commissioner Gammon made a motion to approve. I need a second. Very good. Commissioner Phillips with a second. Call the roll for us.
Commissioner Cook? Yes. Commissioner Key? Yes. Commissioner Gammon?
Yes.
Commissioner Gorley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen?
Yes. Very good. Thank you. Okay, so next is the Health Department report. We've got LaShann Dixon and Dr. McDonald. If you'd all like to come forward. Welcome.
Mayor Ketchern, Madam Chairman, and Commissioners of the Committee, good evening. Tonight I will be presenting the Health Department report along with Dr. Lori McDonald. Please take a look at the September 2020 report of Community Health Outreach. Our 3 columns labeled Promote, Protect, and Improve have not really changed much as our staff continues to work to ensure that we test, provide education, guidance, and to help mitigate the spread of COVID-19 in our county. We also continue to offer drive-through COVID-19 testing at our Murfreesboro site located at 100 West Burton Street at no charge to anyone who wishes to be tested Monday through Friday, 8:30 to 12. As a reminder, tests are free and without any restrictions. Currently, we're testing around 175 people plus a day for COVID-19 with the oral pharyngeal swabs and continue to work all investigation along with public health that comes with positive cases and their contacts 7 days a week. Last Tuesday, a new public-facing COVID-19 site was released. The site is covid19.tn.gov. Again, covid19.tn.gov. This website is designed to streamline and simplify some of our most frequently responses and questions to COVID-19. It has a lot of data for both desktop and mobile-friendly users. The site offers dashboards as well as daily reports with local and state information, including case counts, hospitalizations, and tests conducted. Once again, that website is covid19.tn.gov. The Tennessee Department of Health will also be hosting a Fight Flu Day on November the 19th. This will be a statewide event. So locally, we have planned a drive-through testing event for this day on November the 19th at our Murfreesboro location, which will happen from 8:30 to 12. On this day, COVID-19 testing will not be taking place at any of our health department facilities across the state, as we will offer free flu shots to anyone wishing to get a flu shot on November the 19th. Currently, we still are offering free walk-in flu shots from 1 p.m. to 3 p.m. daily. So a few key points to take away as far as COVID-19. As we all are aware, our COVID-19 cases are trending up in Rutherford County, similar to what is happening across the statewide in many jurisdictions across the country. Also, we also have our mask mandate, which is back in place, and public health is continually working to identify and isolate cases in close quarters and contacts to those to help reduce the spread of COVID-19. We will also continue to recommend and encourage the 3 W's, wearing a mask, washing your hands, and watching your distance. We also want to thank many of our community partners that continue to help us get the education information out about COVID-19. So at this time, I'm going to ask that Dr. McDonald provide you with any additional information and to answer any questions that you may have.
Does anyone have any specific questions? I think LaShawn covered mostly everything. We have picked up our numbers to significantly into the 200s and higher in the last probably 5 days. So, and we're getting a lot more positives. And some of that could be explained by a number of things. But colder weather, people are closer, people continue to gather. We're just going to have to see how that goes.
Yep. Commissioner Key?
Dr. Miss Dixon mentioned that there was an average of 175 a day. Could you describe the procedure that's being used on that? You said the swab. Is that okay?
Sure.
And what's the timing of the results for that?
An oropharyngeal swab. So the car lines come in. It was a single car line, but we've had to pick it up to 2 car lines, and we have people taking down all the information necessary to get back the results to the individual in a timely fashion. There's a whole gaggle of people inside the building that are logging all of that as well into databases. So essentially what happens is they come in, and no matter how many people in the car, if it's a 1-car situation, 1 person gets done. If it's a 5-person car, 5 people get done. So it's an oropharyngeal swab, which we'll do right tonsil, left tonsil, back of throat. You pull the swab out, carefully not touching tongues or teeth, and then that is sent off to the state public health lab in Knoxville. The reason we switched from the nasopharyngeal swab was that it's much easier to turn around the test samples for results. You can do a whole platform of them simultaneously. Takes about 2 to 3 days to get them back. The weekends tend to be a bit of a bottleneck. And there's a bunch of people that are calling the positives, and then the contact tracing continues as best as we can do.
This is Commissioner Gurley.
Yes, sir. Go ahead, Commissioner.
Yes, what's your opinion? We recently completed a 9-state trip visiting our daughter in New York City, and we took the test prior to leaving. That would be week before last. And there are private providers that are, the test takes about 15 minutes. They do a nasal swab, and then about 15 minutes later. What's your opinion of those tests?
Very test specific. I think I mentioned at one of the last meetings, recently reviewed an article from one of the journals, and there's about 256 of those tests available. And what they did was they took all those people that they already knew their real results with the gold standard, which is the nasopharyngeal swab. So if you were a positive, you then got several of the top 50 tests to see how accurate it was. And the bottom line, without bogging you down in the statistics, is that if you are negative and asymptomatic by the gold standard, about 80 to 90% of the time they got it right, which is reassuring. However, if you were positive with symptoms, that sensitivity of that test dropped to about 50%, which is concerning because we do have so many asymptomatic individuals out there. So it's possible you could be asymptomatic, feel great, but have it, and you will test negative on those tests. So the gold standard still is the nasopharyngeal swab. We're getting better with it, and the research is continuing, and the rigorous testing part, everybody has to do it properly, it has to be done quickly, and it has to be done perfectly. And that doesn't always happen, as we know. But it's still, the jury's still out on that one, but there are several tests that are much better. I just don't know which ones people are using around here.
Thank you. I observed, of course, in traveling 9 states, every time we crossed the border, we ran into different rules. Different rules for motels, different rules. Some states have their rest areas shut down, which is somewhat of a difficulty in traveling. Puts more stress on gas stations and mini marts, etc. But I did notice, when I came back, I plotted out today all the per 100,000, the infection rate and the positivity rate. And unfortunately, in the per 100,000 and the positive rate, Tennessee's well ahead of the other 8 states I visited. I'm going to put together some observations that I made. I made a stop in East Tennessee. I got out, and the parking lot was packed. I noticed that only 50% of the people were wearing masks. I know what it's like on a normal day inside that facility. So it was very crowded. Obviously, they were not doing much of anything. So it would not surprise me if that became an infection point down the road, if not already. But it does seem that we have a way to go here in terms of getting things under control.
In fact, Northeast Tennessee did have a bump in their rates last week. So your observations may be very, very on point. We get complacent, and that's when we get into trouble, and it's been a long time that we've been doing this, so I understand that part of it. It's just it's hard to see people die from this, too.
Yes, that's, my daughter's working in the hospital up there, and she said the same thing, and we got together. She did a test prior to coming over into New Jersey to visit with us, and 1 or 2 places we went, we maintained our distance, we maintained good protocol, and she said, I just couldn't forgive myself if I carried this back to someone. So said, I'm seeing people die from it. So yeah, I think that's a point we need to put across to people. People do die from it.
Anyone else have questions? Commissioner Key?
Doctor, you're on the front lines of this. So is the time frame for the spike perhaps correlating to fall break? Can we, your thoughts on that?
It's probably multifactorial. You know, it's difficult. I think people are fatiguing from doing it. The cooler weather, people are tending to get together more. We have schools, and I can't keep up with what school system is remote anymore and which is back because it flips so fast. But I think when the school system started back up, we had some spikes there as well. It's just seems to be, it's out there. And I think if we can, I know that the mask wearing is not popular amongst a lot of people, can understand that businesses and so on will suffer. However, it's clear that our cases, we'll see in the next couple of weeks a decline because of the mask mandates again. And then when we lift it, we'll see them go back up.
Dr. McDonald, did you have any other specific suggestions about trick-or-treating? I know our OIT department put together a really impressive video. I thought it was great and had some really good suggestions of things I had not even thought about, and it was, setting up a contactless station outside, and, so that neither one of you have to get that close. Is there anything along those lines you want to kind of advise people to do who just really have to trick-or-treat?
I mean, it's difficult because you get the young kids who are already kind of a little excited, and things, you're going to forget about your mask. I mean, at least they can have masks on quite comfortably in Halloween costumes. I know the trunk or treater things.
Right.
I know our church just canceled ours because of spikes in the area that church was at. It's just really difficult. I think if they can do the, distancing, to wear the mask and try to not get too sugared up and carried away, that would help.
Yep.
I did read that more Halloween candy was sold this year than ever.
Really?
Yes, so
Interesting.
it's been the biggest year.
Interesting.
I don't know, we'll see what happens. It's going to be a difficult one.
Did anyone else have questions for them? If not, I'll entertain a motion to accept the report.
So moved.
Second.
Would you call the roll for us? Thank you, ladies.
Commissioner Phillips,
Yes.
Commissioner Cook,
Yes.
Commissioner Key. Yes. Commissioner Gammon,
Yes.
Commissioner Gorley,
Yes.
Chairman Allen.
Yes. All right, next we have the community care report, and then the minutes are on your iPad. We usually rely on the mayor or Carol to give us some information about what's going on at community care. Either of you have anything to share?
Madam Chairman, members of the committee, the only thing that I can share is we talked to Mary Beth, our director of nursing out there today. We have, we did have a spike with a number of our patients, but as of today, we have 0 positive for a 3-week count, which is very positive for us. So we were able to get it under control and real pleased with that.
Excellent.
And thank you, EMS and Director Hudgens, for staying on top of that, and Chris Clark for keeping our residents out there safe. The other thing I'll share is that Ben Mankin went out last week, met with the architect and the contractor who was supposed to get started on the renovation. They've worked out a plan. They're going to come in on that wing because we were using the wing that we were going to remodel as where all the COVID wing was, and now that we've got them back into the regular rooms, they're going to come in and divide the wing in half, and so they'll start construction and remodeling one half of it, and once they get that completed, they'll still have that open for triage and then start on the other half. So
Very good.
moving forward.
All right, I'll entertain a motion to accept the community care report.
So moved.
Second.
Okay, that was Commissioner Gurley, Commissioner Phillips. Call the roll for us.
Commissioner Cook, Commissioner Key, Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Chairman Allen.
Yes. All right, next we've got special projects, Ms. Jolly. This is our monthly report where she helps us keep track of all the bills being paid and all the capital projects. Is there anything of any significance you want to point out to us?
If there's any questions.
This is a standard report we usually receive in advance every month, so pretty accustomed to seeing it, but if there's any questions from Ms. Jolly, we'll take them now. If not, I'll entertain a motion.
So moved. Move to approve the report, Madam Chairman.
Thank you. That was Commissioner Phillips, Commissioner Gammon. Very good. Thank you, Ms. Jolly. You call the roll for us?
Commissioner Gammon,
Yes.
Commissioner Gurley,
Yes.
Commissioner Phillips,
Yes.
Commissioner Cook,
Yes.
Commissioner Key, Chairman Allen.
Yes. All right, next we have School Board. They're joining us via Zoom. Welcome, men. I know they're on there. I can see them.
Is this a school? Is this a school?
Yes, sir. Awesome. We're ready for you when you're ready.
All right. We have 2 amendments, budget amendments 141 tonight. The first one is a budget amendment for the fiscal year 2020-21 Safe School Grant, which it's to budget the revenue and expenditures for the fiscal year 2020 and 2021 Safe School Grant. This grant application was approved by the school board on September 3rd, 2020 at the board meeting, and then awarded by the State Department of Education following the school board approval. What it does is it amends the current budget to increase it by $802,804 to brings it up to a total of $986,519. Motion to approve this budget amendment for the fiscal year 2020-2021 Safe School Grant that was approved by the Rutherford County School Board and State Department of Ed.
Very good. Any questions for Mr. Spurlock on that? If not, I'll entertain a motion.
Second.
Call the roll for us.
Commissioner Gurley,
Yes.
Mr. Phillips,
Yes.
Mr. Cook,
Yes.
Mr. Key, Commissioner Gammon,
Yes.
Chairman Allen.
Yes. Very good. You can continue, Mr. Spurlock.
All right, the next one, I want to start off by saying that this is a COPS grant. However, this is the funding that, if approved, will not be used to any salaries or anything of that nature, primarily actually, we'll talk about the radios. But anyway, this is a contract from the federal DOJ, Community Oriented Policing Services, other known as a COPS grant. Rutherford County Safety Director has applied for a federal DOJ COPS grant, and $225,001 over a 3-year period was approved. The grant will provide funding to improve security at Rutherford County schools and on school grounds through the purchase of APX Trunken handheld radios used by school crisis response teams. These radios will greatly improve the response times for our schools in the event of emergency, as the radios will be the same channels as the county emergency services. This grant has a local match of $25,000 per year for 3 years. Now, if approved, this will be funded through either our local tax revenues, or we will be requesting to use some of the safe school, the state safe school grant funds for this appropriation. Motion to approve this federal DOJ COPS grant as presented, with local match to come from either local tax revenues, or if approved by state, the annual Safe School Grant Fund appropriation that we just mentioned earlier.
Very good. I did have an opportunity to speak with Mr. Bottery about this, and I know he's working closely with Lisa Nolan to make sure that any way that we can get the money funded in such a way that it's already been funded. I know that that's what they're attempting to do. So it's a pretty healthy grant for a very little match on our part in terms of those radios, because we were going to be providing radios to those schools anyway. So any questions? All my questions have been answered because I talked about this before the meeting, but Commissioner Key?
Yes, I have a question. Are there any services that would, such as FCC regulations or compliances, perhaps, that would be in addition to this grant, or need to go on past this grant?
I could barely understand it, but about FCC regulations, there aren't any stipulations.
Okay.
Commissioner Gurley?
Yes, Commissioner Gurley, you're recognized.
Yes, I was just going to advise Commissioner Key that all of that will be handled and come under the county emergency management agency's radio manager, and he takes care of all of that, and I'm sure that we're in full compliance with FCC rules.
Very good. Thank you. Are there any other questions for Mr. Spurlock on this? If not, I'll entertain a motion.
Move to approve.
Thank you. Commissioner Gurley? Commissioner Cook? Very good. Will you call the roll for us?
Commissioner Key? Yes. Commissioner Gammon?
Yes.
Mr. Cook?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Chairman Allen.
Yes. Thank you all. And Mr. Spurlock, if you don't mind, stay online for just a second. Under other business, I wanted to discuss our meeting dates. I sent an email to everyone. Commissioner Phillips has suggested that, just really for continuity, that if we would schedule our meetings for the 4th Tuesday after the first Monday of each month. we've gone through and looked at the calendar, and that the only 2 months that it really impacts are December and June. For those of you who are familiar with this committee and have served on it for some time, you know both of those months, those meetings are usually in flux anyway, because our June meeting usually has to be finessed on the calendar to happen in time for budget so that it can happen before the last budget meeting, since we don't meet in July. And then in December, unless there is a significant amount of business from either of the departments, many times we will cancel the December meeting. So I haven't heard any negative feedback from anyone on changing this. If it is an inconvenience, let's please discuss it now. If not, if there's no objection, then I would like for us to implement making that change. Any feedback?
Just one comment, if I could, Commissioner Allen. The reason that I suggested that is September is the perfect example. Anytime a Tuesday falls on the first of the month, it puts our meeting, the Health and Ed meeting, the Tuesday following the Thursday night commission meeting, which gives us very little time to discuss things that comes up at our next commission meeting. So if we moved it to the fourth Tuesday following the first Monday, like our commission is scheduled to do, then it would be in perfect alignment with other committees and the commission, and give us more time between the commission meeting and the Health and Ed meeting. So it would just be a perfect alignment. And from Thursday to Tuesday, when the calendar falls, when a Tuesday falls on the first of the month, just doesn't give us enough time to react to what we need to do for the next month. So it just makes a perfect sense that we do that.
All right, is that in the form of a motion?
Yes.
Very good, thank you. Can I get a second?
Second.
Very good. Will you call the roll for us? Will be the fourth Tuesday after the first Monday. So just like our commission meetings, the way that they fall, everything is kind of in the budget meetings, everything falls after that first Monday. Does that make sense? And like I said, the only
one additional point, Commissioner Allen, all of our Monday meetings, and there's a lot of them that are scheduled on Monday, it has no effect on any of those. Right. But on Tuesday and Thursday meetings, it has some effect. And I would just like to see our committee especially, and maybe even others, follow that guideline whatever it is, like the fourth Tuesday following the first Monday. Once again, it would just put us in perfect alignment with the county commission meetings.
Yes.
It's still the fourth Tuesday, any way you go, because we're having it now on fourth Tuesday.
Right, unless, well, like you said, for like September, if September 1st was a Tuesday, then this would technically be, September would have been the fifth Tuesday, instead of letting that Monday start. We'll make sure you're here, Carol. I'm not going to let you miss. You're too important. Yeah.
It's like county commission.
Yes.
It's the Thursday after the second Monday.
That's right. That's exactly right. Same scenario. Yes, ma'am.
Madam Chair, this shouldn't affect much except, like you said, December and June. Ain't that right?
That's right. Yeah, we looked pretty far out, just mainly to make sure the room was available, but also to see what the impact on the schedule would be. And like I said, the only two that are coming up that it would affect right now are December and June, which those are always in flux anyway. And so usually I tell everyone on the November and December meetings, again, because we have the holidays to work around, keep those on your calendar, but know that they are tentative based on the amount of business that the departments bring to us. If it's not worth coming up here and meeting over, even if it's not pressing matters and it can wait, then we'll notify you and we'll cancel the meeting. So in the back of your mind, you can make it tentative, but absolutely still keep it on the calendar, okay? Okay. Yeah, this is a great example for the motion that we're about to vote on. In December 1st is a Tuesday. If we kept the schedule that we're on now, we would meet on December 22nd. If we change that to the fourth Tuesday after the first Monday, then it would be December 29th, which typically we would end up rolling that meeting back anyway. We typically would not meet the week before Christmas. So, does that help you? I think it's good logic. So, yeah, very rarely, but good logic. So if we have a motion and a second, if you'll call the roll for us.
Commissioner Key? Yes. Commissioner Cook?
Yes.
Commissioner Gammon?
Yes.
Commissioner Phillips?
Yes.
Commissioner Gorley?
Yes.
Chairman Allen?
Yes. Very good. Is there any other business to come before this committee? If not, we stand adjourned. Thank you all.